when you made the ultimate decision to go to do what was necessary to get PPE, who did you ask if it was okay, and how many calls did it take?
You.
And what did I say?
You said do what we needed to do to protect the Mississippians.
Thank you.
Dr. Dobbs, same question.
Yeah, we haven't had any meetings or discussions. Early on, like at the very beginning, before the session really closed, we did have conversations about our long-term needs, but nothing recently. This is a dynamic and a rapidly changing event. I can say that it's extremely important to have a nimble approach. Bringing on new employees, being able to escalate budgets in a near immediate fashion is so very important. So those are just elements that we have to have if we're going to respond appropriately.
One last super quick follow-up. If the legislature does what it is planning to do right now, how much money will be available to you for these emergency escalations as of right now?
Well, if the legislature does what what the House did, and again, it's hard to speculate because we're in the middle of this, and there are senators who I presume would like to have a say in this, and will either ask questions or do other things. This is a very unorthodox situation for a lot of reasons, one of which is, it is very unusual for the legislature to have adjourned or recessed for a time certain and then agree to come back weeks and weeks before that occurs. And so that's in and of itself is strange. I've been I was lieutenant governor for 8 years and don't recall ever not adjourning to a time certain. And so we'll see what comes of it, and then we'll make our next decision based upon that.
The question was how much funds are available for emergency escalations as of right now, regardless of what the legislature's doing.
Right now, I don't know exact numbers, but there is more than adequate escalation. I don't think there is a limit placed on escalation of federal funds for the response, for emergency responses. The Department of Finance Administration is the agency that oversees. Basically, they manage the budgets of everyone's budget. Now, each of these individuals have their own budget team, but the Department of Treasury actually receives money, and then the Finance and Administration actually administers the money, puts the money in the various accounts, things such as that. So I don't know exactly. I'm sure every bill has its own specific amount. But when I was lieutenant governor, I didn't get down in those weeds as to exactly where that was. So, yes, ma'am.
It seems that the bill is going to pass both chambers. Are you prepared to veto the bill, and are you having thoughts of probably suing?
Well, what I would tell you is I can't give you much of an idea as to whether or not I would veto the bill until I see what's actually in it. I hope and pray that I know it passed the House. I hope and pray that senators will try to, maybe they could reach out to the people who are actually involved in this pandemic response, maybe the people, and say, so here's a good question. The bill as it passed the House says that next year, if you don't have specific authority to escalate for the CARES Act in your budget that passes the legislature sometime in the next few months, then you can't escalate money from it. And so my question regarding that is, because we have to deal with this, we deal with it every day. Do you know how much PPE you're going to buy on October the 15th of 2020?
I don't. Hope I don't have to buy any.
I hope you don't too.
But I don't know, sir.
Do you know how many cases we're going to have in October of 2020?
No, sir.
My commitment to the people of Mississippi is, regardless of what the legislature does, within the guidelines that I have, within the laws that I have to adhere to, I'm going to do everything in my power to protect Mississippians, period. Courtney?
You talked about seeing today's numbers, hearing today's numbers, and the kind of disappointment that came along with not being able to reopen more. Can you talk about the thought process and what went through your mind to see those numbers and know what was about to happen across the street?
It's heartbreaking. It's heartbreaking. When you deal with a pandemic, the likes of which look like this. You know, the comments that it's not like we have a Katrina event here. I was around during Katrina. We are fastly approaching more deaths in Mississippi from this virus than we had from Katrina. I hear even some of my Democrat colleagues who weeks and weeks and weeks ago, in the state of New Jersey, for instance, Phil Murphy, weeks and weeks and weeks ago said, on a call, I remember it distinctly because I remember where I was on 9/11, 2001. He said, guys, girls, governors, we were on a governor's only call. He said, today we exceeded the number of deaths from 9/11 in the state of New Jersey. So this is serious. This is really serious. And a lot of Mississippians are dying, and that's a very heavy burden to carry. But when you know you're doing everything in your power to minimize that, to mitigate that, to weigh the differences between the short-term public health crisis and what is a long-term economic crisis in our state. It's a short-term and a long-term economic crisis. If this bill passes and becomes law, and we have to make the determination that, you know, these things that we're doing in employment security to plus up the number of people who are answering the phones, we may have to shut them down. We may have to let them go. Why? For what reason? Because we got a political score to pay? There'll be time for that. Look, these guys can beat me up a month from now or a year from now. When this is over, I'll take it. Just don't hurt people in the process.
Governor, is it true that the third party you placed in the oversight of the money will actually receive a portion of the money that they oversee? I think Speaker Gunn or Lieutenant Hoseman said that at the news conference this morning.
So we haven't placed anyone in terms of oversight of the money at this time. The time frame goes like this. So it was early this week. I don't recall, Ross, if it was Monday or Tuesday. We did an RFQ. We modeled that RFQ and really modeled the entire approach to the way in which Governor Barbour utilized the exact same funds from the Gulf Opportunity Zone Acts way back in 2006. Those passed after Hurricane Katrina. You may recall at the time, Senator Lott was the most recent majority leader in the United States Senate. Senator Cochran was the chairman of appropriations in the United States Senate. So we had a lot of pull in Washington. We have a lot of pull in Washington now as well, but we had a lot of pull, and we got $5.4 billion is how much we got at that time. And so what Governor Barbour did is he developed a lot of programs that had never been developed before, and he made the decision, why don't we hire an independent third-party group to look at each of those individual programs and get pre-clearance from the department. In those times, each department had different looks. Most of those $5.4 billion was CDBG grants, and so most of that was actually administered by the Department of HUD, Housing and Urban Development. And so that third-party group ensured that there wasn't any clawback, because anytime there is federal money, the Office of the Inspector General is going to do an audit and come back and look. We've got one going right now. I inherited it at the Department of Human Services. There's been lots of accusations that federal money was misspent. Now, I don't know all the details. That'll be coming up, I'm sure, that we'll have to deal with in the coming days and weeks. But the Office of Inspector General of HHS is reviewing that. I have been on call after call after call from the Secretary of the Treasury, in which he was on there, Secretary Mnuchin, and he has made it perfectly clear. He has made it perfectly clear. The Office of Inspector General of the Treasury Department is going to make sure that these monies are spent in compliance with the provisions of the Act and the guidance that is offered by Treasury. The other thing I'll tell you, this has been true of the PPP program. Y'all may have seen it. Have y'all noticed that the PPP program, the guidelines has changed at least 3 times on the PPP program? Just in the last 6 weeks, It's changed 3 times. Well, if the CARES Act the monies had been appropriated based upon the first guidance, and then Treasury changed the guidance, I guess we'd have to call a special session of the legislature, come back and change the appropriation bill. What we don't want to happen is for the $1.25 billion that was given to our state to respond to this emergency, for us to, for it to go through any process, whether it's executive or legislative, for it to go through the process, and for some percentage of those funds to be spent in a manner that is inconsistent with the guidelines, and then Treasury come back a year from now and say, hey, you did pretty good. You did 90% of these were right on line. They were in compliance. Now, where's our $120 million check for that 10% that you didn't? The other thing that we have to deal with is, what if Greg decides, and let's just assume for a second that the legislature is on board with whatever his recommendation is. What if he says, you know, I think we've spent X number of millions of dollars in the first 6 weeks of this crisis. I think in the 6 months starting July 1 through December 31, and we'll pick a number. What if he says, I think it's going to cost us about $80 to $100 million more? And the legislature appropriates it and said, look, we're going to be safe. We're going to give you $100 million in appropriation authority of the CARES Act. And then what if the virus miraculously doesn't come back in September and October? And what if Greg spends $0, but yet he's got $100 appropriated, $100 million appropriated? Well, what happens to that $100 million? Got any idea? I'll tell you. It goes back to the Department of Treasury. It goes back to the Department of Treasury. What if we think Dr. Dobbs needs $100 million in CARES Act funds to deal with the public health emergency? And so we give Greg $100 million, we give Dr. Dobbs $100 million because we think it's potentially going to be really, really bad in the fall. And therefore, if we think it's going to be really, really bad, we want to triple the number of people who work for the health department. We want to put in contact tracers, 3 times more than we have right now. And so the legislature, acting in good faith, says, okay, we're going to give you $100 million to spend between July 1 and December 31. And then what if the same scenario happens in which there's no need for it? So we have an appropriation bill where we've appropriated $100 million to MEMA, we've appropriated $100 million to the Department of Health, and we spend none of it. Well, that $200 million goes back to the federal treasury. Meanwhile, I got barbers and salon owners who hadn't been able to open their shop because government shut them down because we have a public health crisis. How about maybe we could send some of that money to barbers and salon owners right now? How about we could send $10,000 to every small business right now for the purposes of buying PPE for their employees? Does that sound like a good idea? It does to me, because Dr. Dobbs says repeatedly we need to be wearing masks in public. But small business owners are hurting. The folks that opened up Monday, the retail shops, maybe the little dress shop over in Flowood or the dress shop in some other small town, they're hurting. But what if they were able to get state money to buy PPE, to buy masks, so that they could give everyone that walked in their mask a mask, because the state provided that through a direct grant to them? Oh no, we're going to wait and we're going to decide in a few months how to spend that money. We don't have a few months. That small business owner, in a few months when it's decided, he or she's going to be long gone. How about the restaurant owner that wants to reopen? The restaurant owner wants to reopen, and we let them. We say, okay, we know it's challenging, but we're going to let you reopen. But we're going to mandate that everybody in there has a mask. Was that restaurant owner going to have to add that added expense of a mask? The restaurant owner didn't shut down his restaurant or her restaurant. The restaurant owner didn't let the virus come from China. So why don't we have plans in place where we can get this money to the people who need it right now, rather than waiting and saying, well, we'll just appropriate $100 million, in my example, $100 million here and $100 million there. We need none of it. The $200 million goes back to Treasury. and our restaurant owners and our barbers and our salon owners and our gyms, who we know are hurting, get nothing. It makes no sense, Ross.
Does the RFQ that you mentioned say that the outside administrator will get a cut of that money?
We would pay the third-party administrator to help us ensure that that program that I just mentioned to you, the program to directly buy PPE for the barber, directly buy PPE for the salon owner, directly buy PPE for the restaurant owner, I believe that's compliant. I believe Treasury regulations would allow me to do that. But there's always value in having a third-party administrator outside of government sign off on, either legally or from an accounting standpoint or otherwise, say, yes, we've talked to the Department of Treasury and they say it's okay. And so the answer becomes, well, hell, Tate, you got plenty of time. Why don't you just decide if it's got time? Why don't you go figure out who the 30,000 small business owners are that would be entitled to get this money? And then you go ahead and you decide if when they get the money, they spend it on the PPE that they're supposed to spend it on. That's what the third-party administrator does, because some of us are relatively busy right now trying to do other things. We don't have the ability in the governor's office to oversee $1.25 billion without some help. I'll tell you, I'm just curious. If the legislature spends, let's say they create a great program, and they say, and they will, by the way, they're going to come up with some good ideas if they get this money. But what they're going to do is they're going to appropriate $125 million, even if it's a good idea, and they're going to expect some state agency to administer it. I've been lieutenant governor for 8 years before I became governor. We reduced the number of state employees from 32,000 down to 26,000. We did it because it was the right thing to do. We did it because we were operating at a level that was good for Mississippi. But we don't have significant increased capacity within state government to run the kind of programs that it takes. You go back and look at what happened after Hurricane Katrina, and I know I keep talking about Hurricane Katrina, but I have experience in it. I was in government during Hurricane Katrina. I was in this building the day that Hurricane Katrina had just swept through the state of Mississippi. For those of you who weren't here, this building was rocking back and forth because we had tremendous winds in Metro Jackson. Because the building was rocking back and forth, we lost power to this building. I was up on the 11th floor. We had at the time the treasurer's office. I hadn't been up there in a number of years, but we had a room that had a generator to keep our computers cool. But with the power knocked off, while we could get a little bit of light, there was no heating and air in the building. Air conditioning is what you needed. Happened on August the 29th. So for the next number of days and weeks, I spent a lot of time in the conference room at the governor's mansion, working with Governor Barber and his staff, mainly his staff who were housed there because they were at that time in this building as well as before he moved across the street. And so I know I keep referring to Hurricane Katrina, but that is the experience that I have with these disasters. It's also the experience that Mississippi has. It is that very experience, I presume, and I will tell you, I haven't talked to Governor Barber in the last couple of weeks. But I presume it's the experience that he had is why he wrote the op-ed today, talking about how important these decisions are that are currently being made and the ramifications to them.
Just a quick point of clarification. The third-party group would have oversight only, no say in how that money was spent. They're just there as kind of a helpful eyes.
Legal and accounting. Legal and accounting. Again, here's a $150 million program. If I say ultimately okay, or even if they do across the street, we're just saying okay, somebody's actually got to send, if it's $10,000 grants and it's $100 million, well, that's 10, 100, that's basically 10,000 grants that have to go out. $10,000 grants don't just happen. I mean, you actually have to send them, and you have to figure out a way to distribute that money, and you have to have a way to have to make sure that everybody that's supposed to get it gets it. I'll give you an example. Treasury sent out checks after the CARES Act was passed, $1,200 checks. Well, some of them they direct deposited. Some of the $1,200 checks they sent to people who had died. And so Secretary Mnuchin has been on a few press conferences and said, hey, if you got your mama or your daddy's check and they're dead, you need to send it back to them. Well, the Secretary of Treasury can do that because he's the Secretary of Treasury. I promise you, if Mississippi sends a $10,000 check to someone who's dead, Secretary of Treasury is going to come to us and say, you owe us that $10,000 back, right? And so we don't have the luxury of just sending it out and hoping somebody sends it back. We have to account for it, and we have to have accountability in who gets what, and it's actually going to the people for which it was intended. When you spend $1.2 billion, and by the way, this is going to be very quick. Even if they wait until June 30 to spend it, that's only 6 months. That's $200 million a month that has to be spent. And so I would submit to you that time is very important.
Governor
Renee.
Reeves.
Dave Elliott from WLX has a question. Dave?
Thank you, Renee. Governor, I'm going to shift gears, and if folks want to come back to this big story, they can. We have reports and photographs of restaurants in Biloxi, Long Beach, serving customers either inside or on patios. And we can only assume this is happening all over the state. Also likely with bars and maybe entertainment venues. How should cities, how should law enforcement respond to that, since it is technically via your executive order breaking the law? What would you say to these business owners?
Well, I haven't seen the pictures, but I have no doubt that we're not getting 100% compliance in our executive order. We have a law in the state of Mississippi which says something to the effect of thou shalt not murder. And I believe April was the most deadly month in the history of Jackson, Mississippi in terms of total number of deaths. And so there are going to be people who do not comply. We are looking at ways to get our restaurants back open. And I had a call with the mayors earlier this week and told them that it was their responsibility to send their policemen if they felt that there was somebody in violation, and if they needed additional resources. This is when we had the ability, knowing that we had CARES Act money, that we could actually send additional state resources out to help our local municipalities and our local counties. We're still willing to do that, assuming we still have the ability from a federal money standpoint to do it.